never want to be a parent of a child that has an allergic reaction or an anaphylactic reaction. You feel completely helpless. And it's the scariest thing. You're watching your child not be able to breathe. When you have too many mast cells, that can be a sign of a clonal disorder, which is similar to like a leukemia or a lymphoma. It can be considered like a precancerous or even a cancerous.
Today, I am so excited to have Dr. Tania Elliott on the podcast, board-certified allergist and immunologist and internist. She serves on the faculty at NYU. She is a nationally recognized voice on telemedicine and digital health. And what can people do to start improving their gut health, or steps you can take if you are currently experiencing allergies?
Not taking antibiotics for anything that's not necessary, not going for an elective C-section. Your immune system needs to learn, okay, these are the good bacteria that are going to be my friends my entire life. And then it also needs to learn these are the bad bacteria. And when I see bad bacteria, then I'm going to activate this component of my immune system.
Do you like any of the apps like EWG or anything like that for women to start maybe like checking some of the products? Or
I think they're better than nothing. This is another thing that's important for women to understand. Like, fragrances are not bad. Synthetic fragrances are the bad ones. But like a lot of times as allergists, we're like, use fragrance free. That's specific for people with...
Today, I am so excited to have Dr. Tania Elliott on the podcast. She is a dual board-certified allergist and immunologist and internist. She serves on the faculty at NYU Langone and has held leadership roles as including chief medical officer at EHE and medical director at Doctor on Demand. She is a nationally recognized voice on telemedicine and digital health, and she frequently appears on major media and advises health systems and employers on virtual care strategy. Welcome to the podcast.
Thanks for having me. I'm excited to be here.
I'm so excited to have you. Today we're going to be talking about a very different topic. I haven't focused on this very much, so I'm thrilled. When we talk about mast cells and histamine and the immune system and allergies. But I would love to start with just some of your background. Like, what brought you interested in this type of work?
Sure. So after my training, I started off in private practice on Park Avenue, thought it was going to be so fancy. And after about like 2 months of delivering care, traditional healthcare in a fee-for-service world, I became very like disenchanted with the system. And it was initially particularly for allergy patients. It just felt very counterintuitive to me what we were asking patients to do. We were asking patients to leave their home environment, come into the office, strip down into nothing but a gown and become a number. And then we would ask them a bunch of questions about their home environment, what they did for an occupation, to get a better understanding of what their environmental exposures were so that we could identify the triggers for their allergies. And we literally used to give them like this little 2-dimensional diorama of a home and be like, can you just mark an X where you have carpeting? Oh, you have carpeting in your living room. Okay, mark X's if you have any upholstered furniture. Oh, and I would like be looking at this little piece of construction paper. And I'm like, this is ridiculous. I wish I could see into people's homes.
Yeah.
And one of the things that really stood out for me during my residency was when I did home visits. I did my residency in New York City at Mount Sinai Medical Center, and I would have people come into the office and I would have one view or perception of them, right? And then I would see into their home and it would change everything for me, right? It's this context, these cues, the environmental cues. And like I said, we strip people down to like nothing, literally a gown in an office. So for me, those cues were really important. And I was like, okay, I'm in New York City. If I created like a home visits for allergy, I'd probably go to like 2 apartments and then spend the rest of my time in traffic. So that's not a scalable business.
Yeah.
I'm like, what if I did a Skype with my patients, because this is like 2013. So like Skype was the thing. And I thought maybe I could do these video visits, video walkthroughs of people's homes to identify potential toxins, potential allergic triggers in their home. And then I thought, well, for food allergies, right, in a new food allergy diagnosis, how scary is it if suddenly you walk home and you're like, oh my gosh, I have a peanut allergy, or my child is diagnosed with a peanut allergy. You need like a whole pantry revamp, right?
Yeah.
And so maybe I could help patients like look in their pantries and say, okay, throw this out, throw this out. Let me help them read labels in real time. Let me take a walk with them to the supermarket and be real time with them in video. So that was like my idea for care. And then the other piece of it as an allergist is allergic reactions last 24 hours or less. If it's lasting more than that, it's not an allergic reaction, because that's essentially how long histamine stays in the body, right? So By the time someone would come to see me, the allergic reaction was gone, and I would be relying on whatever their subjective recall was, whatever it was they were doing, whatever it was they were eating, whatever the reaction looked like on their body. So I was able to make a diagnosis if they had a picture, a picture of what they ate and a picture of what they look like. I wasn't able to make a diagnosis if I didn't have a picture. So again, like this sort of propelled me into this vision of utilizing telemedicine, video, digital health, photos and things like that to get a better overall view of what was going on with my patients.
Yeah.
So that was the backstory. And then that sort of propelled me into getting like a street MBA, working at a startup called Doctor on Demand, which was the nation's first telemedicine video only practice.
Yeah.
That was focused on virtual urgent care. So like,
Mhm.
sick care, sore throats, UTIs, things like that.
Yeah.
And then we evolved the offering into behavioral health. And then we evolved more into virtual primary care offerings. And so I was sort of like this telehealth evangelist.
Yeah.
And I worked in the payer space for Aetna. And then I was at a very large health system called Ascension, all designing new care delivery models, utilizing hybrid care, a little bit in person, a little bit virtual. And what's really interesting about the space you're in, which is longevity, is I actually think that that's the new forefront of telemedicine,
Yeah.
and empowering people with education and information. Like you do such a great job.
Aw, thank you.
Empowering them so they can stay healthy, live your healthiest lives, your best self with lifestyle interventions and things you can do in your everyday life. And then if you are sick, okay, then you can do a video visit with a provider, or you can have frequent touch points maybe with a coach,
Yeah.
and what have you. But like a lot of the longevity care can be practiced outside of an office setting.
Yeah.
So it's just interesting to see that my clinical interests have evolved more into like healthy living, healthy lifestyle. And then now there's this like overlay of the digital health piece.
Yeah. Well, I love that. And first of all, I mean, it's amazing that you as a doctor were going into people's homes, right? I mean, I think if more of that happened, I mean, we would be uncovering so many things, right? Because our environments, as I walked you around my house, when you were coming in, our environments matter so much. So I would love to hear just kind of what are you finding? What are some of the top triggers? Like, what should people know that are listening to this podcast about immediately get it out of your home and then maybe work on these other things?
Yeah. So there's like two pieces of it. One is there are allergens, and then the second piece is there are toxins. And around like the toxin piece, and even to some extent the allergen piece, it's focusing on your indoor microbiome.
Yeah.
We talk so much about our gut microbiome and how important that is, our skin microbiome. We have an indoor microbiome. It's called the air that we breathe,
Yeah.
right? So first we'll focus on the allergies, right? As it relates to your indoor microbiome, it's things like dust mite allergy, mold allergy, cockroach allergy,
Yeah.
rodent allergy. Those are sort of like the most common ones. And then if you do have an outdoor allergy, like a pollen allergy, then making sure that you're not tracking those outdoor allergens into the home. The other indoor allergens are your pets. Dogs, cats, if you have horses, bunnies, wherever they are, you could be allergic to them. So those are allergens. And an allergen, by definition, is an abnormal response to something that is normally occurring in the environment.
Okay.
Meaning these are things that are all around us. And for whatever reason, our immune system perceives those things as a threat. And we get into like the immunology as to why our immune system is perceiving those things as a threat. But that's the bucket of allergies.
Okay.
Then there's the bucket of toxins, which everyone should be aware of. And that really relates to the quality of our indoor and our outdoor air. If we talk about the outdoor air, it's things like diesel exhaust and nitric oxide and sulfur dioxide and things like that. And we've gotten so paranoid about those outdoor allergens that we shut our windows and we forgot to focus on the outdoor toxins. We forgot to focus on like our indoor toxins. Those typically are things called volatile organic compounds that are fancy word of saying things that off gas from materials and products. And the biggest culprits are really anything that's synthetic.
Yeah.
So for example, if you don't have 100% hardwood and it's composite, that's made up of something that can then off gas into the air. You can breathe that in and it can be toxic to you. And it's not just respiratory symptoms. These are also the things that can be your endocrine disruptors and things that can impact fertility. And we often just don't put those things together. But if you buy like a new piece of furniture from like Amazon or something, you ever notice that smell?
Yeah.
Or a new mattress and you're like, oh, it smells kind of funny. Like, yeah, those are toxins, right?
Yeah.
And then you're sleeping on that thing, or you have it in your living room and your kids are, crawling around on the floor and they're breathing all that in. you buy a brand new carpet, right? That's a
Yeah.
synthetic carpet, and you're breathing and you're literally smelling it, and then you forget about it.
Yeah.
And at least in California, there's like a Proposition 65 that actually requires a
Mhm.
tag, but it doesn't say like you can't have these things in your home. It just
Yeah.
requires you that there's a statement that says these things could be toxic to your health.
Yeah.
I wish there was more of like you can't buy these things anywhere, but
Yeah. I
unfortunately we're
agree.
not protected from that.
Yeah.
So you really need to be a smart consumer. Other things, and then I'll let you ask more questions. Fragrances, right, from candles and things that are burned, and that's everything from like the wick, if there's any metal in the wick,
Mhm.
to what the candle wax is made of, and
Yeah.
parabens and phthalates and things like that. So you have to really be aware of that. And then the other are like the air fresheners that are
Oh my
everywhere.
gosh.
Can I just say one thing? I don't understand hotels that
Yeah.
want to make their lobby smell nice, and
Yeah.
there are spraying synthetic fragrance in there that trigger my migraine every time and make me want to throw up. Like,
Yeah.
please,
And
just
Ubers, like, I can't even take Ubers,
yes.
like, at all because they have that little tree in there. The entire time I'm conversing with them about the little tree, like, showing them the data, and I'm like, "This little tree is, like, poisoning you, you know? You have to throw that thing out." But I also feel symptoms, like, I have a headache after I get out of an Uber, so, I mean, I just don't do Ubers anymore, but
And I used to love, like, I still love candles, but I'm very selective about the candles that I burn in my home.
yeah.
But I had to throw away very expensive candles because they were triggering my migraines.
Yeah.
So.
Yeah, I mean, well, I took you on a little walk, you didn't see any candles in here, so I got rid of those a long time ago. I mean, it's I think you just, like, you acclimate and you normalize, like, I don't miss it really anymore, and I haven't really used any traditional fragrances. I There are 2 brands that I think are okay that I will use from time to time, but, I mean, I love this. You and I relate, like, 100%. I feel like most of the time when I walk people through my house, they're like, "This woman is insane, like, why is she measuring everything?"
I was so happy. I was like, "Where'd you get that? I need to get one of these."
Yeah, you were. You're like, what do you want for for this? And I love that, but like it actually is a really serious matter, right? So you and I talked briefly before the podcast about this total toxic burden, for example. If you take a total toxic burden, you're listening to this, and when you get yours, even, you can be eyes wide open after that point. Because the first one that I got like 6 years ago, I was like, oh my gosh, being so healthy. There's no way I'm not gonna have anything bad going on here. And I'm like, whoa, bam, hit with all these toxins in the high range. I'm like, where did these come from? And then I really like went through with a fine tooth comb, like, what am I wearing? Even clothing, right? I mean,
Yeah.
I can't do it 100% of the time, but I try as often as I can to either wear organic cotton or natural materials. And I'm excited to talk about natural materials with you too, but things that are breathable, linens, wool, cashmere, stuff like that, organic if possible. Because not only is the material potentially a little bit toxic, but then you have companies, I think it's outlawed now, right? They're not allowed to spray like flame retardants on kids' clothes anymore. Is that
Yeah, that's finally one
right? I
advancement.
mean, this is wild. So you're like sleeping, a little baby is like sleeping in a flame retardant. I mean, this is so sad. So, I mean, such important points. If it relates to, as it relates to ordering something off of Amazon and then bringing it to the home, would it be helpful if they just like left it in the garage for a few days to
Yeah.
off gas a little
Yeah,
bit?
that is the recommendation, that you wanna leave it in the open it up, whatever
Mhm.
it is, because look, all natural materials are expensive,
They are,
right?
yeah,
Not everybody can afford them, so what can you do? Leave it
yeah,
in the garage, open it up, and just let it sit there for a few days. Make sure that there's aeration in your garage as well, because those are
mhm,
typically not well ventilated spaces.
yeah,
So, like, have the garage door open. If you can, leave it outside for a couple of days, as long as the weather is gonna be okay and your
yeah,
furniture's not gonna get ruined. But you wanna do that for at least 72 hours, because
mhm,
the off-gassing, the VOCs will go down with
yeah.
time. It's not that they're just gonna be there forever off-gassing at that same amount. So it's really at the time that you open them that where the VOCs are the highest.
Yeah. Yeah, absolutely. I remember I opened this, like, organic blanket, as they said, and I had it next to an air doctor at the time, like an air purifier, and it immediately, like, went off red like crazy, and I just packed it up and sent it back, and I let him know too. I was like, "Hey, Jessica," I mean, I wasn't doing an air test, but I mean, to me, that was enough of a statement that when I opened this package of this, like, organic material and then my air doctor went to red and stayed red for, like, 20 minutes, I'm like, "That seems like a problem."
Well, it's like what we were talking about before, about all the greenwashing on a
Mhm.
lot of these materials. Like bamboo sheets is another one that people thought were healthy, and they
Yeah.
were pitched as healthy. And I think it was Walmart that actually got sued because they
Mhm.
were pitching bamboo as these healthy sheets, calling them non-toxic. The truth is, think about a bamboo tree and how much it would take to turn that into like a soft, amazing sheet or t-shirt. So much chemical processing takes place. So it's harmful to the workers, and then it's also harmful to the end user. So what we were talking about before is making sure that the things that you purchase have specific certification, like GOTS certification or Ecotech certified. What's the other one? Green Guard certified.
Yeah,
So
Green Guard is good. I'm actually exploring flooring. So I want to do my garage floor, but obviously there's so many issues with that, right? The rubber mats typically off gas like crazy. So then I looked for alternative options. I think cork is a pretty good option for some people, but because it's so hot and humid in Texas, it would warp, they told me. So I did find, and I think the brand is called Ecor, but it is a Green Guard certified floor. And then, I think it's okay for people to ask for, like, I ask for all the reports.
yeah.
I'm like, can I see the reports? And what conditions are you putting this material under? And then checking the report, because if you're purchasing something like the garage floor where I know it's going to be really hot, I need to make sure that they're applying some heat and then seeing what happens with the VOCs.
Exactly.
So,
Yeah.
well, we're like over here
Rabbit
doing,
hole.
major rabbit hole. I love it though. But from a basic takeaway, I love the idea of just putting the new purchase in the garage and let it off gas for a little while.
Yeah.
I think that's great. And then would you say also having like good air purification in the home is important?
Yep, that's important, and you want to make sure that whatever air purifier you have is the appropriate size of the room, and then you also want to make sure that you are filtering the right stuff. So, like, if you're concerned about allergens, you want to make sure you have a HEPA filter. If you're concerned about VOCs, you want to have an activated carbon filter, and you really want to make sure you do your research in terms of like things that are tested, because sometimes things will be good at absorbing VOCs, but then because of whatever airflow, it actually shoots them back up into the air. Consumer Reports has done like really good studies on this, looking at it. So I would recommend going there if you're going to look for an air purifier, what their recommendations are.
Yeah, that's a really good point. And also even just simple things like making sure you're changing your HVAC filters at a frequent enough pace. I think ours are supposed to be changed every 6 months. I have my husband do them every 3 months.
Yeah.
And I see the difference on my air quality monitor. So, those little things I think can all be really helpful. Okay, so I want to dive into the immune system. So we know that, women have differences in immune system, right? I mean, 80% of autoimmune conditions are women. I also feel as if this is becoming so much more prevalent. I'm curious, why do you think that is? What are the differences? And then we'll talk about maybe like, strategies that we can implement.
Yeah. So allergies in general affect 30% of the population. And then when we think about like overall, just allergies and allergic conditions are on the rise, whether it's like allergic rhinitis, which is just like the itchy runny nose, allergic skin disease, which can be eczema, which you typically see in children, but also allergic contact dermatitis, which is a reaction to a product that's coming into contact with your skin. And then we're also seeing an increase in mast cell specific diseases, mast cell activation syndrome or mastocytosis. So first we need to understand like what is a mast cell and what is its role in allergic disease and what's mast cell activation syndrome and all this sort of thing. So a mast cells are your allergy cells, just a fancy way for saying your allergy cells. Your allergy cells contain the most famous chemical, histamine, which is responsible for itching, swelling, redness, congestion. They also contain some other immune inflammatory markers that are responsible for swelling, and those are called leukotrienes. But essentially, like your allergy cells, your mast cells are part of your overall immune system. And we have two components of our immune system. Th2 cells, which are comprised of these mast cells and eosinophils. These are like our allergy cells. And then we have Th1 cells. Those are your immune system cells that fight against viruses and bacteria. The Th2 cells, those allergy cells, mast cells, and eosinophils, used to have a role in fighting infection. They used to fight parasites. And interestingly, in developed countries, you don't see as many allergies because those immune system cells, those Th2 allergy cells, are busy fighting against parasitic infections. And so they are doing their sort of life's purpose in fighting against parasites. In a developed world, we don't really see parasitic infections as much. So I like to say that those allergy cells, mast cells and eosinophils, get bored. And when you don't have the proper immune exposures in utero, through a vaginal birth or a vaginal delivery, or within the first year of life in terms of exposures to good and bad bacteria, so your immune system learns and knows how to develop. Your Th2 cells, mast cells and eosinophils, are like, what am I supposed to do? Maybe this thing is foreign. Maybe that thing is foreign. Maybe this thing. And they start to react to things that are normally occurring in the environment, hence allergies, whether they're allergies to foods or allergies to things in the environment. And so the hypothesis is that we lived in too clean of a world, in a bubble. We're chasing our kids around with hand sanitizers. That's one thing. We're giving antibiotics to pregnant moms and to little children. And all of those things skew, goes back to the gut, the good bacteria in our gut, and then the right types of inputs for our immune system to develop properly.
Yeah, this is so important. I mean, because so I had to go on a round of antibiotics and I measure my gut health obviously all the time. So I do a gut zoomer like 4 times a year. And so as expected after the antibiotics, my gut was, dysbiotic. And for the first time ever, I started getting these like little rashes to pop up. This was a while ago, but it's so clear. So can you talk to me more about like that gut? I mean, I knew it had to have been because my gut was, not super strong like it normally was. So how are those related and what can people do to start improving, their gut health or steps you can take if you are currently experiencing allergies?
Yeah. So like going back to like birth or like pregnant moms, right? Not taking antibiotics for anything that's not necessary. So if there's a bacterial infection, fine, but otherwise trying to avoid taking antibiotics. The second is not going for an elective C-section because the first exposure to good bacteria is through the vaginal canal. So when you bypass the vaginal canal and you have a C-section, now sometimes they're indicated you don't have a choice, but we've seen an increase in allergies correlated with an increase in maternal C-sections. So just an important thing to note. And then the other thing is breastfeeding for the first 4 months if you can. And all of those, so doing that, again, transfers the mom's immunoglobulins. It confers a whole bunch of other benefits, but mom's immunoglobulins over to the baby, again, giving the immune system, developing baby's immune system, the right inputs. And the reason why I'm kind of going back and forth between good bacteria and immune system is your immune system needs to learn, okay, these are the good bacteria that are going to be my friends my entire life, right? And then it also needs to learn these are the bad bacteria. And when I see bad bacteria or, bad pathogens, then I'm going to activate this component of my immune system. And when I see parasites or what have you, I'm going to activate this component of my immune system. And so it is those exposures that then shape the way in which your immune system works.
Yeah. I was told once that if you do have a C-section, should you do like a swab of the vagina and put it in the baby's mouth?
I don't know about putting it in the mouth, but I've heard about doing a bath in like the vaginal fluid to try to just recreate that experience for the baby.
Yeah, interesting. Well, we'll have to look more into that. But a functional medicine doctor that I used to have on my staff actually when I had a clinic, she was a big fan of that. She's like, if you ever get a C-section, you have to transfer that bacteria. So interesting. Okay, I mean, ideally, we all have that, right? But so I'll tell you a little bit my backstory. I mean, I grew up on, I thought that pink medicine, the antibiotic, was like a normal food group, I don't know why I was so like sick as a kid, but I had chronic ear infections and just all sorts of things, right? My mom later told me, she's like, every time I gave you milk, you would throw up. I'm like, Mom, didn't you think that was like a sign of something? Maybe don't do that. So if you didn't kind of start off on the right foot, if you're listening to this now and you're pregnant or about to have your baby, please like do all the things. But how can we improve our immune systems? Like how can we fix it a little bit?
Yeah. Before I even go to that, there's one important thing to identify and recognize is that we completely underdiagnose immune deficiency. So if you have more than a couple of sinus or ear infections in a year, more than 4 in a year requiring antibiotics, that's a trigger for you to have an immune deficiency workup to make sure that your immune system cells are functioning properly.
Yeah.
And that means one of two things. Either do I have enough immune system cells in my body? Do I, have the right amount of immunoglobulin? And are those immunoglobulins firing away and functioning properly when I am sick?
Yeah.
And if you do have a low number of immunoglobulins, there's treatments for that. So it's for sinus or ear infections within a year requiring antibiotics. That should prompt an immune system workup, or 2 pneumonias in a year requiring antibiotics. So a lot of people, they're just like, oh, I just went to the pediatrician. Oh, I just went to urgent care. Oh, I just went here. Oh, I just went there. And guess what? It adds up, and you should have your immune system evaluated.
Yeah. Yeah.
So that's just sort of like a side note. But
No, that is really important. I mean, I don't remember how many I had in a year, but I remember like frequently, I had a couple sets of tubes for sure. But I also don't ever recall having an immune system workup. Thank goodness, though, now, like, I suppose the lifestyle I live, I really rarely ever get sick. So
Yeah.
thank goodness for that.
So what can you do to protect yourself? So one is making sure that you do have sort of like the right balance in your gut. Whether you, and I think it's a combination of like the foods that you eat, the healthy foods that you eat, fermented foods like kimchi or even the brine of sauerkraut, as crazy as that sounds, to try to nourish your gut. And you want to have prebiotic, probiotic, and postbiotic butyrate. I think all of that's a combination that's important.
Yeah.
Prebiotic is the food that the good bacteria need to grow.
Mm-hmm.
I'm just sort of, you probably already know this.
Yeah,
but
no, but
sort
it's
of
so
helpful to
important. Yeah,
say.
it's so important.
A probiotic is the good bacteria itself, and we're still learning which strains are the true good bacteria. So like our natural foods know, the supplements, like, look, sometimes it's hard to like walk around with like a jug of sauerkraut and it probably like smells disgusting. But wherever you can get it from foods, but otherwise, just, with a grain of salt that like not all probiotics are created equal, but better than nothing, right? So that probiotic are the bacteria themselves. Postbiotic are the byproducts that the good bacteria make in order to help heal and support your gut and your immune system. So it's important for people to understand like what it is that they're taking and sort of have that well-rounded approach. The other thing, just from a natural perspective, quercetin and curcumin, which is the active ingredient in turmeric.
Yeah.
So those two supplements turmeric helps to reduce inflammation, and quercetin helps to stabilize your mast cells. So those are sort of things you can do at baseline. The other thing you can do, depending on sort of, how bad your symptoms are or how reactive your mast cells are to consider a low histamine diet. There are certain foods that are very high in histamine content, like red wine and aged cheeses, certain fruits, like if you ever get an itchy mouth from pineapple, that's histamine, strawberries. So you may want to consider, at least during peak allergy season, considering a low histamine diet. It's not going to be the be all end all, especially if you have very, very reactive mast cells, but it couldn't hurt to, reduce the amount of histamine that you consume.
Yeah. Yeah, that's a really good point. So you're saying like if it's also peak allergy season, it's kind of like I always say we have like all different size cups, right? Genetically, and then you're like adding too much to the cup and then the cup tips over.
Exactly. It's multifactorial. It's like all the allergens that are outside in the air, or you have an indoor allergen that, that you're allergic to your cat and you're not getting rid of your cat, right? And then it's the added effect of like cumulative high histamine foods.
Yeah.
Yeah.
So I want to dive like really into this mast cell. Is it mast cell syndrome? So when people are experiencing like constant activation, feel like I've been hearing about this more now than ever. What is that, and how might people get out of that rut?
Yep. So there's like the spectrum. First, we talk about allergies, right? And our allergy cells getting activated. That's when you actually have antibodies circulating against something normally occurring in the environment. So that's like an allergic response, and you have antibodies circulating. The treatment of that is avoiding that specific trigger. Then you have something called mastocytosis, which is an increased number of mast cells in your body, allergy cells in your body. So where do those allergy cells live? They live in your upper respiratory tract, ears, nose, and throat. They live in your lungs, right? That's why people get asthma, allergic asthma. They live in your gut, which a lot of people don't think about. And so you could actually get really bad bloating and swelling of your intestines. They live on your skin, which is why so many people have skin-related symptoms and rashes and itchy skin. And then they also even live in your cardiovascular system and like lining around the nerves.
Interesting.
So just to keep in mind, so mastocytosis means too many mast cells. Mast Cell Activation Syndrome, or MCAS, means normal number of mast cells, but those mast cells are like ready to just activate whenever. So they're just like firing away to anything. And it's kind of hard to make that diagnosis because like you've got like multiple triggers. You don't know when you're going to get triggered and you don't have a specific antibody. Like it's not like, oh, it's just a shrimp. And then we can check and you're like, oh yeah, you have IgE, an immunoglobulin, an antibody to shrimp. This is just, I've got agitated mast cells, mast cell activation syndrome. The way you diagnose it is checking a level called a tryptase level right around the time of an exposure to something. So it's really hard to like have this attack, this allergic attack, and then get to a lab in time, right?
Yeah.
To like get a test and the tryptase is only elevated for like 2 to 4 hours and then it's gone.
Yeah, I mean, that's
So it's
almost
really hard to
impossible,
capture.
right? Yeah.
And then sometimes you could have a normal tryptase level, but you can look at urinary histamine and catecholamine levels, which are byproducts or breakdown of the chemicals that are released from mast cells. But it's kind of hard to diagnose. So we often end up with a clinical diagnosis, which is we ruled out a whole bunch of other causes, which is really important because I don't want people to think, oh, I just have mast cell activation syndrome, and then we're missing an underlying cause. So we could talk about those underlying causes. And then it's sort of a clinical diagnosis based off of the symptoms that people are experiencing.
Yeah. And so where do people start? Like, let's say that you have this mast cell activation syndrome. What is your recommendation? Like, where can you start
Yeah.
to improve?
So seeing an allergist is important, but when you do, you want to come in and do your homework and be like, here are my symptoms. Here's documentation of those symptoms, back to the whole like value of telemedicine, but documentation meaning like I've taken pictures. This is the rash that's on my skin. This is the bloating that's occurred in my stomach. This is my lip that's blown up, like, and actually documenting that. And then documenting all of your exposures as best as you can within like a 4 to 6 hour period of the reaction.
Yeah.
And you want to do that as many times as possible to try to put together a picture. And like being an allergist is really like detective work with the patient to try to figure out what's happened and what's going on. And so most people don't have symptoms like so frequently. So it's really hard to remember to be like, oh gosh, I have to write all this down.
Yeah.
But come prepared as you can, or like whatever potential like triggers you think they are, you can sort of come with that. But one challenge is then you lead the witness of the doctor, you know, where you're like, I think it's this. And then the doctor is just like so laser focused on what you say that they forget to ask you all the other questions.
Yeah.
So the other things to consider, like, has your environment changed in any way? Have you traveled internationally? And I'll talk about why that's important recently. Any stressors that have changed, like, you know, kind of think about the macro level, anything that's changed in your diet. What about where you're purchasing your foods from? Has that changed? Have you frequented any new restaurants lately? Like really, and so sometimes I just say like, just document your whole life for a week and then let us have a conversation about what you were doing, who you were with, was that a new thing, you know, and piecing that together.
So in both cases, if you have way too many mast cells or mast cells that you have are like incredibly angry and really sensitive, you can put it back into like a normal homeostasis, or is this something that people deal with for years or forever?
Yeah, when you have too many mast cells, that can be a sign of a clonal disorder, which is similar to like a leukemia or a lymphoma that really needs to be like monitored. And you can be considered like a, you know, almost like a precancerous or even a cancerous when you have what's called systemic mastocytosis, which is just an overproliferation of mast cells, right? When you have an overproliferation of like white blood cells, you end up with a type of like leukemia or lymphoma. So that sort of falls within that bucket of systemic mastocytosis. Not all of them turn into cancers, but like that's the risk. It's like a overgrowth, right, of cells. Mast cell activation syndrome is different. You have these overly active mast cells. The question is why? And like what is the root cause and what are those triggers? So I talked about like things that you need to make sure that you rule out. So that we're left with, okay, nope, I just have overactive mast cells. So what would you need to rule out? Well, infection, because remember, those mast cells, those Th2 cells are meant to fight infections and specifically parasites. So getting a stool culture and making sure that you don't have a parasitic infection. That's also why I asked about international travel and exposures to all types of bugs and all other kinds of things. So ruling out infection, a parasitic infection, ruling out viral infections like hepatitis B and hepatitis C, and then ruling and HIV, and then ruling out autoimmune disease. So we often see a correlation with thyroid disease. We can also see it with lupus. And what's a little bit scary about it is sometimes these conditions, the mast cells being aggravated and tickled, so to speak, are the first sign of an autoimmune disease. And then the autoimmune disease happens like 10 years later, 10 years later. And so for 5, 10 years, someone's like, oh, you're fine, you have mast cell activation. And then years later, they end up with an autoimmune condition. So that's just something to sort of keep in mind. You're not crazy, and it could be a precursor for an autoimmune condition.
Do you think that maybe a factor of developing the autoimmune condition is because they were stimulated? So it was like throwing the immune system off balance for so long?
It could be. It could be a bit of a chicken or egg situation. And certainly stress is another one that plays a role there.
Yeah.
So hard to say whether they're predisposed to an autoimmune condition and that's sort of the path that they're on, and this mast cell activation is the first manifestation of it, or the mast cell activation is then triggering the autoimmune.
Yeah. So I've kind of read, and I'm super excited to hear your thoughts, that women have maybe a little bit more sensitive, is that the best way to put it, immune system. So we might be able to recover from maybe sickness faster than men, but because it's more active, then we also can develop these like autoimmune conditions. Number one, is that truth? And then number two, if so, how can women maybe better tend to their their immune systems? Because when I was living in LA, I don't think there was a single woman that came up to me. And keep in mind, people listening, people come to me asking about health stuff more because I'm in the space, right? But every woman that I met had Hashimoto's. It was wild. And I just can't understand, why is this happening?
Yeah, I think there's a couple of factors. So one is like fluctuations in our hormones and the fact that they shift and change like every 7 years from like when you go through puberty and beyond. And those fluctuations in hormones, at least as it relates to allergic disease, anytime you've got a fluctuation, you have an elevation in estrogen, that can then trigger allergies and even autoimmunity to some extent. We don't quite understand the mechanism, but there's a correlation between estrogen levels and histamine levels.
Okay.
And then also we'll see like during perimenopause and menopause, all of a sudden, a woman who was never allergic to anything sort of becoming allergic. And we tend to see it more with like contact allergy, personal products and things on the skin.
Yeah.
So we don't quite understand the mechanism of action there, but there's some relationship between hormonal fluctuations and flare-ups of our allergies. And the best example of that is when women are pregnant. And 30% of women who have allergies, their allergies get better. 30% of women, they stay the same. 30% of women, their allergies get worse.
Interesting.
So I guess it's 33, 33, 33.
Why do we think that is, the fluctuation in hormones?
Fluctuation in hormones, and like, some people get the pregnancy glow, other women don't, whatever it is. So that's sort of our proof to know that there's a correlation between hormone levels and allergies, but we don't quite understand the mechanism or the science yet. The other is we use a heck of a lot more personal products and fragrances than men do.
Yeah.
So those things that we're doing, that we're putting on our skin, that we now realize are hormone disruptors and have all these negative consequences and side effects, we need to start to make the correlation that perhaps that also is contributing to autoimmunity. And what other things are we doing? Lifestyle interventions, all of those factors, the things that we're putting on our skin, probably at a higher rate or faster rate than men, more products, and how is those external factors impacting the risk for autoimmunity.
Yeah. Do you like any of the apps like EWG or anything like that for women to start maybe like checking some of the products? Or
I think they're better than nothing.
Yeah.
Right?
Yeah.
And like this is another thing that's important for women to understand. Like fragrances are not bad. Synthetic fragrances are not good, are the bad ones.
Yeah.
Depending on how they're made, right? Typically, though, if it's like 1-butyl ethyl, blah, 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 and you can't even pronounce the name, like you probably shouldn't be putting that on your skin. But I'm someone who used to like love wearing perfume and things like that. And some synthetic fragrances are derived from natural sources and things like that. But like a lot of times as allergists, we're like, use fragrance free.
Yeah.
That's specific for people with allergies. Like essential oils and things, those are great. But they are common contact allergens. They can cause allergies in people. But I want people to understand that natural fragrances are okay. Plant-based fragrances, things like that are naturally occurring fragrances are okay. It's just that some people can have an allergic reaction to them. But those are not the things that are hormone disruptors. Like that's separate from synthetic fragrances.
Yeah. Yeah, that makes a lot of sense. What is this phenomenon? So I just moved to Texas, and everyone keeps telling me that this fall, they call it cedar fever, I think. And so what is this phenomenon? I mean, in my brain, I can't imagine it. I'm like, I can't imagine being totally derailed by something just by moving. But what's going on there?
So it's the pollen from cedar trees, which pollinate in the fall and in the winter time. And if you are allergic to them, you can get something called cedar fever, where your allergies are so bad and your asthma gets triggered and your nose is running and it's like horrible and people feel like they have the flu. If you're
Jeez.
not allergic to cedar, and for you, if you've never been exposed to cedar before because you lived somewhere else, then you're going to be fine, at least for the first year.
That's what
Because
people
it
say.
takes
Yeah.
12 months for you
Ugh.
to develop the sensitivity or the allergy to it.
So is cedar just like a really common allergen or something?
Yeah, I mean, it's a native tree to this area.
Ugh.
And the other thing is pollen loads in general are just much higher. And that has to do with like above average rainfall that we experience, warmer than usual temperatures. So like the pollen season lasts longer. And then also the pollen will combine with pollutants in the air like nitric oxide and diesel exhaust and sulfur dioxide and become super pollen. So
Oh.
even if you don't have allergies, you will react to these like super pollens, which are very irritating to the nasal passages. So you breathe that in and your body's like, what the heck is that? Get it out of my nose. And you're going to have an immune reaction to it, just a localized reaction. And you're going to sneeze and your eyes are going to run. It doesn't mean you have allergy antibodies, but your local allergy and immune system cells are getting activated by what feels like an irritant in the air.
Goodness. Okay, so what can I do to prepare for this season? Was there any truth to like local honeys or things like that?
Look, you could wear a mask. As
Oh,
much as we say, like, oh, mask, this and that, they help with allergies. That's why,
yeah.
actually, I don't know, like in Japan, you see people like wearing masks in
Mm.
like the winter and in the springtime. It's not because they're worried about transmitting the flu, it's because of the cedar trees.
Oh, wow.
So they're wearing masks to protect against allergies.
Wow.
So
Okay.
you could do that if you want to be a little more discreet. They actually sell like nasal filters on Amazon. These little like that you
Oh.
can put in your nose. It looks like you like, oh, Kayla got a nose ring. Okay, and you can
Nice.
that would
Okay.
just reduce the amount of allergen. The other thing that you can do is as soon as you come indoors, you don't want to track that pollen into the home. That's why I always say like take off your shoes, wash your clothes, take a shower, rinse off your hair. Don't
Yeah.
wear hairspray because pollen loves to stick to hair.
Yeah.
So avoid using hair products, wearing sunglasses, things like that to sort of minimize the amount of pollen that gets on you.
Goodness gracious. Well, I'm interested to see how bad it's gonna get because I can't imagine myself being okay with like just feeling flu-like
You'll be
for
fine this year.
multiple. Yeah, well, except but next year. I mean, I wonder how long that period is supposed to be. Like
Well,
months or like,
yeah, it's typically from like the late fall until like February.
oh my gosh, that's
And it's
horrible.
right around cold and flu season also, which is really a bummer. And then also, if you have uncontrolled allergies, you are more likely to develop an infection because think about it, you have all this mucus production that, like the viruses activate allergy cells just like allergens activate allergy cells
Mhm.
and immune system cells. So you're in this like hyper reactive immune state. And viruses and bacteria love mucus. They're like, this is cozy in here. And they get in, and then you end up with getting a superimposed viral or bacterial infection because you're so congested with the allergies.
Goodness. Okay, so supplements to take around that time would be the quercetin and the turmeric or the curcumin.
Yes.
Anything else you would add to that?
You asked about local honey. I think that there's value from like antimicrobial, antibacterial properties from honey in general that are great. It's also really soothing to the throat. Will it help specifically with allergies? Probably not, because bees will pollinate very, very bright flowers. They're not going and pollinating cedar trees. And
Yeah.
so in order for the phenomenon of local honey to work the way people think it works, the theory is that there are bits of pollen from the bee, right, that get into the honey, and you're exposed to a small amount of pollen, and then your body becomes sort of trained to become immune to it,
Yeah.
or immunotherapy, right? But like I said, the bees are pollinating very, very bright flowers. Those are not the things that cause allergies. They're not pollinating cedar trees, right? So it's the wrong type of pollen that's present in the honey.
Got it.
If you are interested in immunotherapy, that's something that allergists can do in the office. You can either get drops under the tongue or you can do injections.
Interesting. Can you explain this to us, immunotherapy?
Yeah. So immunotherapy is basically taking small amounts of the allergenic protein, so of the allergen, and giving you small amounts of that so that your body is trained to no longer be allergic.
Mm.
So if you're allergic to cedar trees, we would take the major protein in the cedar tree. We would sort of put it in a concoction, whether it is like something that you would take sublingually underneath the tongue, or we would put it into a subcutaneous formulation. And we start at really, really tiny doses of that protein. And so you may have a local reaction, or you may have like a little bit of like an itchy mouth initially, but then slowly over time, we're giving you more and more and more of that allergen, and it provokes the right type of immune response. And you then become tolerant to the allergen over time. And in 80% of people, they can be completely cured of their allergies. And this is sort of a natural inoculation, or a way to train your immune system to no longer be allergic. It's like, hey, here's a little bit of this thing normally occurring in the environment. You're still good, right? Hey,
Yeah.
let me give you a little bit more. You're still good, right?
Yeah.
A little bit more. See, you had nothing to worry about.
Yeah.
A little bit more. And then your body's like, oh, I'm used to this thing. I'm good.
I love that. I mean, should I start like doing that before the cedar trees, or should we just wait to
You
see?
don't need prophylactic immunotherapy, although it'd be an interesting concept. The real question is, do you have a history of allergic disease or allergies in general?
Yeah. I
And
mean, no, not really.
so you're lucky.
But everyone keeps going on and on about this cedar tree, how it's going to be such a disaster. And my husband's like, do you want me to take the cedar trees out from the front? I'm like, I don't know if taking those one out from the front are going to really.
No, because the pollen travels like up to 50 miles. So it
Right.
doesn't matter, you're stuck whether you have them outside your house or not.
Okay. Well, that's
We'll
interesting.
see. We'll talk in a year. We'll see
Yeah.
what to do.
Yeah. I'll maybe texting you and being like, I need help with the cedar tree thing. um, what about kids? I mean, kids' allergies seem to be wild now. I don't recall growing up and so many people having allergies.
Yeah, and there's like a real problem that I am seeing, that's going to be even more of a problem. I'll talk about it in a moment. But essentially, like, we've seen peanut allergies, food allergies in children skyrocket.
Yeah.
So we talked a little bit about like the use of antibiotics, not exposing kids to like dirt and bacteria and farm animals and stuff early on. So they show that kids who like grow up on a farm in their first 12 months of life are less likely to have allergies. Kids who have older siblings are also less likely to have allergies. Why? Because the older siblings go to school, they get a cold, they come back, the little kid gets a cold, and then their their immune system develops like, oh, that's a cold. My immune system needs to remember that and react to that. But instead, we're like keeping kids in little bubbles. We're chasing them around with hand sanitizer. We're not letting their immune systems evolve and be exposed to good and bad bacteria and viruses and things like that. So there's all those like factors. And then we delayed introduction of peanut to children. And I don't know if you've heard this before, but the American Academy of Pediatrics came out, I think it was like in 1993 or maybe it was 98, and said, we're going to delay introduction of peanut until the age of 2. And we think that that's going to reduce the chances of kids having peanut allergy. And also peanuts are a choking risk, so like delay peanut introduction. And all of a sudden, 10, 15 years later, peanut allergy skyrockets.
Wow.
In Israel, peanuts are used for teething rings. And so the incidence of peanut allergy in Israel is 0.2%.
Interesting.
0.2% because the child is exposed to it early on. Whereas in the US, not exposed to it. Now the incidence of peanut allergy is 10%. Why? Because all those kids and children's like older siblings were eating Reese's peanut butter cups and peanut butter and jelly sandwiches. So peanut was around. Peanut was everywhere. So those children, those babies' initial exposure, at least this is the hypothesis, was through the skin. The skin is not an immune tolerant organ. The skin is our largest immune organ in their body.
Yeah.
The gut is the tolerant immune organ. So when you eat something, your body's like, oh, I'm eating this, I'm good. My gut is breaking it down and tolerating it. When the initial exposure is through the skin and then you eat it, the body's like, oh no, that was a weird thing that came in through my skin, and you develop an allergic reaction to it.
Interesting.
It's also why we say, like, allergists say, don't put food products on your skin, right? Wheat-based products that we put on our kids' skin, oat-based products that we put on our skin, almond oil, right? And now you see like wheat allergy, gluten allergy, you see tree nut allergy, right? The biggest risk that I'm seeing right now are that schools are peanut and tree nut free.
Got it. Yeah, that's
So what happens, your kid's in school, you're like, I'm not even going to have nuts in the house because I can't even give them to my kids as a snack. And so we are inadvertently creating a, population of children, school-age children that are avoiding tree nuts I guarantee you we're going to see an increase incidence in tree nut allergies, like skyrocket
Yeah.
in this population and then future generations until we get a little bit smarter about not limiting
Mhm.
having tree nuts and peanuts in schools. It's like we're doing the same exact thing, right?
Yeah.
We said don't introduce peanut till the age of 2. We delayed it. We see a rise in peanut allergy. Now we're saying in schools, it's a nut-free school, and everyone's so proud that it's a nut-free school. What do you think is going to happen to the incidence of peanut and tree nut allergies?
Wow. I mean, yeah. Is there like any sort of like protocol or place that people can look like what age did you start introducing peanuts
As
and nuts
soon
to
as
your kids?
possible.
Okay.
I mean, you want to obviously like make sure that you mash it up and that it's not a
Yeah.
choking hazard, but you want to introduce things very early on. So we say like 4 months to start introducing, whether it's peanut powder or bomba or things like that to our children. Give them as many things as possible and as many exposures as possible early on. One thing I want to say, because I'm not insensitive to children with food allergies, and it's super scary for you to send your kid to a school
Mhm.
and you're like, oh my gosh, my kid's allergic to peanut and tree nut. Granted, the incidence is 10%. And now what if they share and they eat a cookie? So there's like, it's very scary. So I can understand the sentiment to want to have peanut and tree nut free schools. I think the more important piece is education.
Mhm.
Like, don't share your food. You're not going to get an allergy from just breathing in the peanut or tree nut in the air. If so, kids with food allergies wouldn't even be able to walk into a restaurant and breathe in the air or walk down an aisle of a
Yeah.
supermarket. So it's not about breathing it in the air
Mhm.
unless you literally had a paper bag over your head and someone was putting peanut powder into it and
Mhm.
you're breathing in that way.
Yeah.
Um, clean down surfaces, make sure that children are educated and respectful, and other types of, make sure that EpiPens are present in schools, make sure that children, students and, I'm sorry, the teachers and staff are trained,
Mm.
right? And they were educating versus creating potentially like an epidemic of food allergies in children
Yeah.
by.
I mean, that's so tough. Yeah, I saw this video on social media and I was like, this is because I don't have kids yet, but I'm gonna start trying to have kids probably after all my international travels that I told you about. But they were like taking their child in the hospital parking lot to give them the peanut butter or whatnot. And I'm like, is this really what like we're having to do these days? I mean, it just seems wild. That's so scary.
I know. Well, because there's a lot of fear. Like, you never want to be a parent of a child that has an allergic reaction or an anaphylactic reaction. It is the scariest thing ever. You feel completely helpless.
Mm.
God forbid you don't have an EpiPen on you. And it's the scariest thing. You're watching your child not be able to breathe,
Yeah.
and so then you think about like you're trusting your child to go to a school and you're worried about the food that they eat. So I love the reassurance that it provides to food allergy families. However, we just have to weigh and recognize that we are likely going to create more of a food allergy problem in the rest of the population by having these places be peanut and tree nut free.
Yeah, yeah, that's a great point. Well, what would you say are, your top 3 to 5, like, takeaways as it relates to what people can do for allergies or, even their children, either or?
Yeah. Well, certainly people that are suffering from mast cell related disorders, it's really hard to find a doctor who's going to listen to you and actually
Mhm.
take that time to understand, whether there are potential exposures in your home, whether there's things that you're eating that could be contributing. So you really want to make sure that you get the right care team, and it's really hard. You're not crazy.
Do you
This
have
is
any
a real thing,
do you have any recommendations? Do you take on patients still?
people can always reach out to me on social media just to, general information, not medical advice.
Yeah.
Um, the NIH has a great program. Mass General has a great program in
Mhm.
Massachusetts. There are also some like really good organizations
Mhm.
and national societies where people kind of share their experiences with providers. So
Yeah.
looking on like online groups and things to find support systems.
Mhm.
And then really like being empowered with that information about what those potential triggers are.
Mm.
Because oftentimes there is a trigger, right?
Yeah.
Whether it's mold in your home, an environmental toxin, a synthetic fragrance, synthetic candle, and like taking all those steps to sort of purify and detoxify your home,
Mhm.
um, detoxify the type of food that you eat and reducing ultra processed foods. and detoxifying relationships, because I can't underestimate that, and the importance of clearing out unhealthy and stressful relationships,
Yeah.
and how that could affect your mast cells.
Yeah. If you remove something, like you finally find the trigger for the mast cells, I mean, how long can it take to like normalize them to like calm down?
Yeah, I would say like 4 to 6 weeks.
Okay.
And then the way to sort of truly confirm the diagnosis is then you have a re-exposure in a controlled setting and you're like, see, this is clearly the trigger.
Yeah. Okay. But you might be able to introduce that thing down way down the line though. Like reintroduce it. Or you should just
Well,
completely stay away.
you should stay away, but like I said, like our bodies change every 7 years. So like you can revisit it after you go through like perimenopause and menopause and be like, oh, my immune system's not as reactive anymore. And as we age, like your immune system does tend to get a little bit less reactive. So it's
Mhm.
possible that things that triggered allergies before don't trigger them down the line.
Yeah. Well, we also know obviously immune system is a big part of aging, right? Like the decline in your immune system function. What are any tips that you have to maybe, I don't know, like is there a way we can kind of tune up our immune system over the years to keep it a little bit more resilient?
It's the same stuff that contributes to longevity, like increasing your physical activity, building your muscle mass, because you want to make sure that you have reserve and resilience if you
Mhm.
if you do have an infection, you are exposed to something. The supplements like quercetin and turmeric are great. Like I like to have a turmeric latte,
Mhm.
but add a pinch of black pepper to it, which helps with absorption.
Yeah.
But and making sure that you're having like nutrient dense, nutrient rich foods as well.
Yeah. Well, I've loved having you on the podcast.
Yeah.
Thank you so much for being here. Where can people find you?
You can follow me at Dr. Tania Elliott, and please reach out with like topics and things that you want me to cover, and any of your followers want me to cover.
Yeah.
I always love recommendations.
Yeah, she does a really great job, like just creating like really quick, super actionable videos. So I really appreciate them. And we'll make sure to include all of your information in the show notes. So
Awesome.
thanks so much for being here.
Yeah, thanks.